Christmas card. We're gonna hand deliver those to agencies who have people who just need maybe a little warm wish or a Christmas greeting. So if you're one of those agencies that you think you have a family or an individual that you think would enjoy having just a Christmas wish, let us know and we'll drop off some of those cards to your agency as well. So you can hand deliver that or put that into a gift bag or whatever you might be doing for some of those families that you're working with. I don't need to hand them out because they are on the table. Anybody else doing nonprofits? Give where you live. Want to do a quick shout out?
The
Yes,
Elks, the
yeah.
Elks are doing something for Give Where You Live for veterans and youth drug awareness.
Fantastic. Deb is here somewhere too with Loper Cats. Where did Deb go? She's hiding somewhere. Deb showed her. Oh, there, she's waving at me. She's got a mouthful of food, that's why.
I'm sorry, what did you say?
Give Where You Live. Loper Cats and Carney Rescue Cats.
Loper Cats, Carney Rescue Cats, and Friends of the Shelton Public Library.
There you go. Another group of nonprofits. Anybody else want to do a shout out?
Yeah, can I talk for the Arc of Buffalo County?
Yep.
So our organization supports individuals and families with disabilities. The first 40 donors get a $10 gift certificate to the lodge. So we hope you'll check us out tomorrow.
Thank you, Penny. Any other Give Where You Livers? Maddie, you have any you want to promote? We're doing Give Where You Live commercials. Okay. I will hand it off to whoever's starting. Is it you, Erin?
Yeah.
Okay.
I'm Erin Small. I am a 6-time child care partnership coach with Kearney Public Schools. I'm a co-lead on this work group. Denise, you can correct me if I'm wrong, but did we want to ask them to introduce themselves as not just their job or?
Yeah, let's do that when we do the resources.
Okay.
Will that work?
Yep.
Okay.
You want to introduce yourself?
Sorry, Amy Showhome. I'm the early learning connection coach consultant for the central region of the state, out of ESU 10.
I'm sorry, can I rephrase that?
Yeah.
We can do introductions and resources together. So if we want to do that now, we can. I just thought at the same time if we do them at the same time. Does that make sense? Introduce yourself and share your resources.
Yeah, that's fine. We talked about maybe taking our professional hats off too.
Yes, we did. Yeah, go for it. You're
Okay.
the leader.
I'm gonna go ahead and introduce myself as a mom of 4. I have a 15-year-old, a 13-year-old, 11-year-old, and an 8-year-old, all at Kearney Public Schools. If anybody's willing to take their professional hat off and come as a parent and your professional hat a little bit too, we would love that, but you don't feel obligated.
Oh, I can do that. So I'm Amy. I am the mom of 3 boys. My oldest son is 20, almost 22, and he's on the autism spectrum. And then I have a son Carter, who is 18, and then a son Riker, who is 12.
I'm Libby Harsh. I'm a mom of 3. I got a set of 20 girls that'll be senior, or they are seniors, and then a 12-year-old boy, all in the Kearney Public School District.
I'm Dina Johnson. I am a mom of 4, a grandmother of 6, and a great grandmother of 1. I'm from the La Vista area, and what I do is I assist parents in finding childcare. I work at the Early Childhood Training Center, so I do help childcare providers as well with the NECFRS. I have information about NECFRS that I can share with you now, or that I would be able to bring to events as they come up.
Steve Quillick, I'm a lieutenant for the police department here at Kearney. Personally, my wife Janelle, she's a Brett Features preschool teacher, some of you might know her. We have 3 boys, 21, he's a senior at UNL. I have a senior in high school also, and then another boy that's a freshman in high school, so 3 boys as well.
I'm Tran Patterson. My husband and I have a 21 month old.
Janelle Black, I'm a social worker at the VA Suicide Prevention Program. I am a Navy mother. My son was in the Navy right after 9/11, and so he's in Omaha now with a little boy, and my daughter has 2 children in Omaha too. Leslie Martin, I'm the community for kids relief, coordinator. I'm from Pleasanton. I have 2 daughters in their 20s and 2 grandchildren under 2.
Oriana with you with Community Partners, and I'm a new mom to a little, almost 4-month-old boy, Barrett.
Debbie Schroeder, I'm not a mother. I have a niece and 3 nephews that look on me as mom, although one of my nephews is now a medical doctor, but he still looks on me as kind of a mom.
Hi, I'm Paige. I'm a social worker at Horizon Middle School. I don't have any kids, but I have a really cute dog. Our common name.
Nikki Peterson, we were Kearney High School, social worker. 3 kiddos, I have a 28-year-old daughter and a set of identical twin boys who are juniors of the Kearney. I'm Crystal Zimmerman. I'm a counselor at Kearney High School. And I have 2 children that are graduates of Kearney High School and they're successful.
I'm Kathy Gifford. I'm at Kearney Public Schools. I'm also on the Buffalo County Community Partners Board of Directors. I have 2 children, 2 grandchildren. Both my children are graduates of Kearney Public. One still teaches there. She has one. So, and my husband was a graduate of Kearney Public, so we're pretty entrenched.
Hi there, I'm Dan Endorf. I'm also with Kearney Public Schools. I have 3 children, and they are Ella, who is 21 years old, and she goes to the University of Virginia College of Law. My son Austin is 20 years old. You can do the math on that one. That was an interesting time with them that close together. He's at Nebraska Wesleyan, and then I have a junior boy named Asher, who's at the high school.
I'm Carmen Throckmorton. I'm one of the service providers for the NAP program. I teach elementary, kind of in middle school and special ed. I have 3 inherited boys and a farming son. My oldest is 25 and is married and has my granddaughter that is almost 2 and a granddaughter on the way. My second is a security guard at the police department in North Platte. He's 21 now. My 15-year-old goes to Kearney High. And my 13-year-old goes to Nick.
I'm Ken Schaefer. I guess I'm a semi-retired pediatrician and still see patients with the healthcare. Retired from private practice 6.5 years ago. Lived in Kearney for 5 years. Both my kids graduated from Kearney. They have 5 grandchildren from 14 to 20.
I'm really on that, you know. I have 2 boys, one in heaven and one here. 23-year-old here, that goes to school at UNK. He is going to be a biology professor. And my 26-year-old went to heaven in August of 2020.
I'm Penny Parker. I work for Nebraska Childcare, one of the Medicaid companies in the state. I have 2 kiddos. My oldest is a senior at the high school, and my youngest is a 6th grader at Horizon. My husband's name is Howard, and he works at YRTC, which I feel like does make sense. Some of the conversations we have at our house and things that you heard. So hopefully that can come into play here.
I'm Candy Koenig. I'm a mom of 2 young adults, and my oldest 22-year-old is the reason why I do the work I do, and I'm at the Monroe Meyer Institute here at Kearney at Children's Physicians.
My name is Doug Kramer. I work at the Buffalo County Attorney's Office. Been there 20 years this month. I have 3 boys. One is my son, the other 2 are bonus boys. All 3 made it through high school and college, 2 out of 3. One is in Albuquerque, he works for the University of New Mexico, and is finishing his PhD. The other one is in Degree, or the other 2, one's in Kearney, does all the radio or the graphics for KDRN and Lex. And then the youngest Nathan, who's 23, manages a GNC store in Greeley, Colorado. So we have fun places to visit. Trying to think of anything else. I don't have any grandkids that I'm aware of. And I do have a dog too, that's pretty cute.
Wanda Fedorczyk with Buffalo County Community Partners. We have two kiddos in APS system, a sixth grader and a freshman.
I'm Jody Trejo with Midwest Encouragement and Counseling Center. I have two kids here in Kearney as well, at Kearney High and one at Park Elementary.
And I'm Martha Marcelino. I have 3 kiddos in heaven and then 2 here on earth. One's a 7th grader and the other one's a 1st grader.
I'm Danny Asadi. I'm on the Buffalo County Community Partners Board of Directors. Other than some volunteer work, my real job is commercial real estate and property management. I'm a lifelong Kearney resident, went to Kearney Public and Kearney High. I have 3 kids. The oldest is a graduate student in Omaha. The middle is a senior here at UNK, and the youngest is a senior at Kearney Catholic, and a cute dog.
I'm Tana Miller, and I'm the Behavioral Health Coordinator at Green Blue Partners. I have one 10-year-old boy, he goes to Pleasanton, and 3 cute dogs. I don't want to one-up you, man. They do have one really cute puppy that's new and brand new.
I'm Jason Owens. I'm the principal here at the Many Round Center for Success. I have 2 kids. My oldest is 23 and then grad school at Xavier in Cincinnati. Just got married last summer. My youngest is a junior at UNK and she burned her coat at North Pole Express last night. So standing next to the heater in the shack. So I gotta buy a new coat now. So, yeah, so that was fun. And I just got a new puppy.
One up again.
And she's really cute, and her name is Travis Kelsey. But my mom calls her Kelsey. That's it.
I am Denise Weiner. I'm actually from Pleasanton, also the Executive Director of Buffalo County Community Partners. I have 3 adult children. Interestingly, they're all in school right now. One's working on their doctorate, one's working on their master's, and one's on their undergrad. I am married. Our family are a family of suicide survivors. My husband has a traumatic brain injury and lives in Genoa in a nursing home. So I have kind of the other spectrum of the early childhood of the Medicaid, Medicare, nursing home issues that also are very near and dear to my heart as well.
Matt Morris with Community Partners as well. My wife and I were kind of the pseudo parents to her younger sister who's lived with us for the past 3 years and went to Kearney High. She should be graduating hopefully here in December. We'll see how the quarter finishes out. And then next July, my wife and I should be having a little one of our own. So invested in this whole conversation, we had a whole meeting about prenatal and everything. So
You were taking notes.
yeah, mental notes. So
I'm Emily Lehman, from North Platte. I work for Unite Us. I don't have any children, but I have 5 pets. They're not all cats either, if anybody was thinking that. Look, single women and cats, they go, you know what I mean? 2 cattle dogs and 3 cats. That's kind of.
My name is Dulce Valdez and I work for ESC as the Migrant Project Coordinator. As a mom, I have 6 kiddos and 1 in heaven, so my 6 kiddos here. I have I don't know, should I go older? So I have a 12-month-old baby. He's gonna be 1 Friday, and I have a 3-year-old daughter in Bright Futures. I have a 12-year-old 7th grade student on Horizon, a 14-year-old freshman in KHS tonight. I have a 16-year-old and a 17-year-old junior and senior North Platte Public Schools. And my one in heaven was from July or June 2019. So, unborn.
Thank you all for sharing that. I think sometimes.
We had somebody.
Oh, sorry, Liz.
My name is Veronica Levine. I'm the prevention coordinator with the Safe Center, born and raised here in Kearney. Kearney High, UNK, I don't know what else, single, this is funny. Kids, pets, I don't have any pets. I love the Chicago Bears, no one come at me. Jason, I love your dog's name.
We have Eduardo facilitating for us on Zoom, and actually Nicole's on there too. Eduardo, do you want to facilitate introductions on Zoom? Give us a thumbs up. Let's get introductions from Nicole, Natalie, Susan.
I'm Nicole Hirsch. I am a co-lead on this group. I work for the Department of Health and Human Services as the Children and Family Services Specialist Supervisor. My team mainly does permanency work, which is adoption, guardianships, children that are going to be aging out of the system. I'm entering my 18th year in child welfare, so obviously near and dear to my heart that I've survived this long. And I have a stepdaughter that's 30 that has blessed us with 2 grandbabies. And then I also have 3 boys of my own, 12, 9, and 7, and they attend Pleasanton. Thank you.
Susan, do you want to introduce yourself? Oh, go ahead.
Susan Nickerson, Nebraska Department of Economic Development. I have 2 grown children, a daughter in Austin, Texas, who's a CPA, and a son who's in New Orleans, who's an engineer. So fun places to visit. No grandchildren from them, but 2 stepsons. One of them has 2 children. Our grandchildren are 1 and 3. Very fun.
I also see Natalie Hanna introduced herself on the chat. She's a home childcare provider and is most often not able to go speak on here since she's watching children. And she also says she has 2 teen daughters who both attend the Hanna Rom Center. Michelle Tucan is on from Community Partners. She doesn't have a microphone. For those of you who follow her, she's in Austria this week and then headed off to South Korea for 2 weeks next week. And let's see, Alexandra Dillon is also on from the Early Learning Connection Coordinator at ESU 10. She's a parent of 2 adult children. Jennifer Beck, I saw you did a shout out earlier. I'm sorry I missed that, Jennifer. The Kearney Area Children's Museum, Family Scavenger Hunt, and Hot Chocolate Bar for Give Where You Live. So they're also on the Give Where You Live tour tomorrow. Amber Cochran, she helps with Hot Meals USA, has 5 children and 1 in heaven. Thank you for sharing, Amber. And I think that leaves JC Walrath, if you would like to introduce yourself, and then Lacey Witt, and then Marcella.
My name is JC Walrath, and I work for Sherman County Prevention Coalition, mainly drug and alcohol prevention, but mental health promotion. I also sit on the Sandhills Collaborative, so it's kind of nice to see the differences in those things. I have a husband and 1 daughter, and horses and cats and all of that. My daughter's 24 years old. She graduated from the University of Nebraska-Lincoln and then has left us and lives in Oklahoma now on a bull ranch.
Lacey, we can't hear you, hon. I'm sorry. I can see your lips moving. But it's really good.
Hello, can you hear me now? Can you hear me? Yeah. What I was saying is my name's Lacey Witt. My most important job is being a mom. I have an 8-year-old son and a 12-year-old daughter. Both are at Loomis Public Schools right now. My other job is the director of the inpatient units at CHI Health Behavioral Health. I'm Richard Young here in Kearney, managing the inpatient for the adolescent and the adults. I also sit on the loss team and have a huge passion for suicide prevention and early intervention for these kiddos. So thank you for having me.
Hi, I'm Marisela Navarra, Early Learning Connection Specialist out of ESU 10. And I have 2 children, a 7-year-old girl and a will be 3 on Monday, a little 3-year-old guy. And yeah, thank you for having me here.
I see Jennifer also posted to introduce more about herself. She's the Director of Community Engagement at the Kearney Children's Museum, and she does not have any children, but she is a full-time caregiver and advocate for her sister who has special needs. So thank you for sharing that, Jen. And did I get everybody? I'm trying to remember if I introduced Amber. Anybody else on Zoom that would like to introduce themselves? I think I saw somebody maybe come in late too. We're introducing ourselves in a personal way, not necessarily our organization and what pays us to be here. However, you can do both.
Okay. Wish I'd known that. Matt Lohmeyer. Personally, I mean, I work in ministry and like work for a hospital that is in ministry. And so this kind of work is kind of core to what I studied, what I felt passionate about in the school. What I try to do wherever I end up.
And professionally, you're at CHI Hospital.
Yeah, CHI here in Grand Island.
We just need to approve minutes from last time. Motion to approve. 1 second. Thank you. Then we have the overview of collective impact. That was Alexandra. So
I can do that fairly quickly, I think. At the last meeting, and this was a really good idea, and I think it actually come from Alexandra. There are sitting around on the table, if you have a laminated packet in front of you. Last month, we made copies of all of those, and I think most of you were able to take those back with you to your offices. What we decided is we'll bring these laminated copies to every meeting because this is the work that you guys have accomplished in the last, well, a year to 6 months for this group and the steering committee. So it's all of your work to date. We'll probably reference different pieces of that today, but just know that those packets will keep bringing. I do believe, maybe a thumbs up for Michelle, but what I do understand is that if you go to our website, so bcchp.org/2030 vision, or just click on the drop-down menu of 2030 vision. This document in its entirety is in a PDF form, so you can also collect that for yourself. We are doing orientation, so if this is your first meeting, we are doing orientations. Michelle Tucan, our marketing director on staff, is doing those. So if you'd like to dig into that tool a little bit more, to see how the work is that we've been doing has been coming together, we can do that as well. Just let any one of our staff members know that you'd be interested in that. And orientation will do that. And I think everybody got, oh, no, the table tents. There's a sheet of paper sitting in front of you. If you just want to fold that in half, there should be some markers you can pass around and just fill out a table tent with your first name, your first and last, whatever you would like. Reindeer on it, whatever get you excited today about introducing yourself to the group. So that our collective work is that laminated piece that's laying around. So if you want to see it, maybe just raise your hand and to make sure and get a copy of that. Head down and just kind of pass those around so people have a chance to look at it. Anything else you guys want me to mention in regards to that?
So last time we met, we talked a little bit about quick wins, and a year from today, kind of where do we want to be, what kind of wins we want to have. So quick wins that we established last time were an education fair, a resource list, which could be website interactive or paper, social media resources, a parent fair, community response coaches meet with childcare providers to connect them to resources, baby welcoming bags through hospitals, and then make sure that we're promoting MyLink. So a year from today, what wins we thought we could accomplish: peer-led conversations, tracking referrals of families, youth and parents are encouraging others, parents know access points in the community, parents advocate and know value of engagement. There's a web of support and strong family engagement center. Then we did resource sharing.
Yeah, so this is where we attempted, and I think we did a darn good job last month. We went around the table, we said we had 20 minutes. Everybody gets less than a minute to share since there's about 50 of us here. And share a resource that you'd like the whole group to know about. Or if you want to pass, you can pass and take more time at the next meeting. If you have brochures that you want to bring along to hand out at this time for the monthly meetings, you sure can. But I'll go ahead and set our timer to 20 minutes and Jason, you want to go first and we'll go that way around the room?
Yep. Like I said, I'm the principal here at many around 70%. We're a non-traditional school in Kearney Public Schools. We don't enroll kids here. They come through an application process from the middle schools and the high school. We don't serve kids outside of Kearney Public. So we have a middle school program, a freshman program, a sophomore program, and multiple junior and senior programs. We have night school on Tuesday nights, open door, which means students schedule times to come in and work for a couple hours and then they go to their job or what have you. So a lot of different things. I do have some pamphlets that has everything we do. If you guys are interested in them, just come hit me up later and I'll give you some. So thanks.
Leslie, I'm kind of looking at you, whatever I don't get to, you take next. Just a few, we have quite a bit of early childhood resources out right now. One is what we're calling our substitute workforce list. So we are trying to build a base of early childhood substitutes to be able to, well, it sounds like substitute for any of our childcare providers. We know that there's workforce shortages and workforce issues. So if you know of anyone, we've really tried to hit like the senior population, but we're also looking into maybe the college population as well. Anyone that would be interested in volunteering, please reach out to Leslie or myself. We really want to get this up and rolling. We only have till April, so it's important that we get some of this moving. The other piece that we have what we call childcare champions. We have 4 childcare providers in the community that are reaching out to anyone who might want to become licensed, because we have $2,000 stipends available for anyone who would like to become licensed or move from a childcare one to a childcare.
She's just gonna say time up. I'll pass on my minutes. You want it?
Yeah, okay.
I'll have one. I'm Jody Trejo, so I'm the owner of Midwest Encouragement Counseling Center. We provide mental health services to children and adolescents, consultants for families care, and early Head Start and Head Start programs. We're also working on a collaborative right now too, bringing some things to town in which we'll be doing some vibroacoustic work, and it's really about doing some neurosequential work with children who have experienced trauma or on the spectrum, and so we're partnering with UNK on that venture. So yeah, we're really excited.
And I would say from our perspective, we have some opioid prevention resources for not just opioid, substance abuse prevention. Their handbooks are called Operation Parent handbooks, middle school level and high school level. So if you're interested in some of those, I can get them for you. I didn't bring any considerable thinking, but they're a nice tool to use. Kind of has information on everything from social media safety and drugs and alcohol, bullying, all of those things. So the other thing is we have flex funds available for families in need of like rent, utilities, those types of things. We do take those referrals from folks that are already working with families. So we don't have clients call us directly. They are talking with someone who maybe needs some help, and then they'll go to other agencies. And if there's a gap and those needs aren't met, then that person can send a flex fund to us to help with that. Kind of confusing, but let me know if you have questions.
The Buffalo County Attorney's Office, we have a juvenile services unit. Usually there's 4 of us. We're down a staff member. Didn't have anybody apply the last time, so apparently there's more jobs out there that people are interested in than working with kids. We do truancy and then diversion programs are the main ones, and then any of the uncontrollable referrals that we receive, we refer the families usually out to services in the communities. We cover Buffalo County and then also Sherman County. Our office also writes the community based grants through the Nebraska Crime Commission. Buffalo and Sherman County together get about $180,000 a year. We use that for diversion, truancy. We do it for victim youth conferencing through central mediation. We pay for that. We also have contracts, sub-grant contracts with the health partners, also with central mediation, Compass, Boys Town. Kind of develop that. There's another round of grants coming up December 21st. So I better start writing that soon. Total about 750, almost 800 kids a year, kind of gone up each year. All we do.
My work with the Monroe Meyer Institute means that I focus on children who have disabilities or chronic healthcare needs. So I work with their families over at Children's Physicians, but I am able to help anybody in the community. They don't need to doctor at the clinic. So if you have families who might need some resources about waivers, medical cares, just things that may fall through a crack or they have a gap somewhere, they can contact me for that assistance. Kenny Parker with Nebraska Total Care, one of the Medicaid plans. I do have a few things I want to talk about. So every year our company collaborates with an organization called Beyond Differences, and they have a program called No One Needs to Know, which is a social isolation initiative where they combat social isolation in school. Great for middle school age kiddos or older. That's every year in February. We have partnered with Kent Sugaru at Horizon in the past and some organizations in our area. So if anybody wants more info on that, let me know. Then we have resources on our website, nebraskatotalcare.com, that are available and anybody can use. First is the My Route to Health. These are online resources, or we can have in print books, journals, health trackers on hand washing, dental care, physical activity. A lot of them have like a parent resource guide, and they're dual Spanish and English resources. So check that out if you're interested. The Southern Kids Club and a mascot named Phoebe, if anybody needs a mascot for any reason, and a list of well child checkups and when they should be completed. Value adds for our Medicaid plan, we do offer free YMCA membership to anybody that is a Nebraska Total Care member. And we also offer money that's loaded on to a card for our members when they complete healthy behaviors. Some of those preventative measures are well child checkups. So if you have kiddos, 2 or 3 kiddos on a Medicaid plan, they get $10 every time they go in for a well child checkup loaded onto that member's card. So that is an additional resource for them. And then finally, we do offer care management, which is just more kind of hands-on care for families that may be experiencing maybe chronic illness, or maybe they're in a situation where they don't have access to computer or looking for utilities. We have people that can reach out to them regularly to make sure that things are okay. And then I also am a member of the ARC, and there's nobody else here representing the ARC. So I do want to talk about the ARC Buffalo County. We are an organization that serves individuals and families experiencing disabilities, that can be intellectual disabilities or physical disabilities. So we have programming that happens throughout the year. You can watch our social media pages for more information on that. Right now we have Christmas parties coming up. So if anybody's looking for a place for families experiencing disabilities to have some holiday celebration, on the 10th, they will have kids meeting Santa Claus, and on the 5th, we have like a dinner and dance happening. So, yeah, thank you.
I think I'll just bring up briefly about the healthcare clinic. Somebody else is here. We serve individuals after birth with death. We're basically interested to take care of people that do not have any insurance, that do not have Medicare or Medicaid, or have no means to pay for their health care. It is an outpatient setting. not for acute care. In other words, you have to make an appointment, be seen, and we're open 3 days a week. Tuesday, Wednesday, Thursday, and we're open Thursday evening. We take care of most medical problems, although we do not do any prenatal care, basically obstetric care, limited gynecological care, since there are other resources. Services. Anything else?
I'll just give my time. All right, Dan Endorf, I'm the Director of Student Services and Safety with Kearney. As some of you may recall, there's an initiative called the Student Assistance Program that I introduced last month. That program continues to evolve with the hope of implementing here on January 1st. Further, I appreciate Denise allowing me to invite some Kearney Public School leaders that are over here to my right. I came to the first few meetings and I realized a lot of your questions I simply couldn't answer. I don't have the experience, the knowledge that the three of these people do. And so we have Ms. Zimmerman, Ms. Peterson, and Ms. Mock, two social workers and a counselor that, again, I just think it's good that Kearney Public Schools has some representation at this meeting beyond myself. Ms. Gifford's fully capable, don't get me wrong, okay? But these are the experts over here when it comes to a lot of what you do, and it's just important that we all stay connected with one another, and we all appreciate what you are doing on behalf of almost 6,000 kids in the school. With that, thank you for everything, and I look forward to speaking a little more to this program here toward the end of the agenda. So thank you, Penny. And you guys can speak to yourself if there's anything else.
I don't know if there's anything else to add besides, we are at the high school planning a fundraising and working for our Bearcat Cares clothing and food closets. That's something we're looking forward to working with those students who we give a little extra help to on every week. They stop by the counseling office and pick up food guys. Their coats are closed and hygiene products. So we're planning that for the future, and we're here just to, I guess, be supportive of the new initiative and to question.
Nikki Gosling. That's it.
Leslie Martin, C4K, Tana hit a lot of our highlights. We do still have some funding left in our scholarship program for people who are struggling to pay their childcare needs bills. We have some guidelines that they must fall in order to qualify. And then I have some quality and capacity funding left for providers who are trying to build their quality capacity in their childcare system. So we pay for some curriculum or training and things like that. Okay. Janelle Brock with the VA. So the VA has taken a public health approach to suicide prevention. So I have a lot of information. If anybody wants me to drop any information off to their office, we have stress balls, we have gun locks. So anything that you might be able to hand out. The only thing we do not have is the 988 stuff yet, because even SAMHSA doesn't have that. So we are telling everybody that the telephone number still works, and it will work for quite some time yet.
Well, I am Trina Patterson. I am the Health, Nutrition, and Mental Health Service Coordinator for Head Start and for Early Head Start. Kind of wear a lot of hats. And we are the central service area for Head Start, which means we cover 7 counties. We have about 20 centers and about 10 home-based programs. We are Early Head Start and Head Start, which means our Early Head Start program covers pregnant moms all the way up through 3 years of age. And then at 3, they can transition into our Head Start program, and our Head Start program goes from ages 3 to 5.
We do a lot of work with not just the kids in a classroom setting, but we do a lot of work with families. We have family connection nights every month. We partner with other community resources such as our mental health providers like Jody, and we do a lot with the kids. We offer additional resources through our sister agency, which is Community Action Partnership of Mid-Nebraska, and that includes different agencies like the ride service, the food bank, and more that we can kind of connect our families with Head Start to.
As I said earlier, we're with the police department. We're constantly trying to build relationships with the youth and give a positive impact or positive reputation for our police department. So as they grow older, that they can trust us more. We do a lot of we have a lot of calls of uncontrollable youth where parents are kind of at their wits' end with kids, and we're constantly looking for resources to give these families. To try to talk with these kids and help the families out the best we can. Those are pretty much daily issues that we deal with. Some things we're doing as a police department to try to build those relationships and improve what we do is we are running a Youth Citizens Academy in the summers. We had 25 youth go through that in the high school. Next year, they might expand that to 50. Some other things they do, we do a lot of community events. So I strongly recommend if you have families or people that can benefit from that or anybody, it's open to the public. We try to do multiple of those community events throughout the year. Got several officers that are mentors, whether they're assisting at Kids Royal Camp or Kids Hope USA. Doing that, we have 3 SROs at different schools, trying to get those behavior rooms when it's not a matter of crisis, but when the kids are just normal day activities to try to build those relationships. All our officers have mental health training, most have crisis response training, where we do presentations to parents for cell phone safety. We do presentations for current drug trends for families. We're always willing to talk to somebody and try to do our best to help a family out or to improve communication between us and families. So we're always willing to do our part. So, and I apologize that I will have to leave this meeting early. So when I sneak out, not personal, but I got some stuff on the agenda, so I apologize, but I will have to leave early today. Sorry, Aaron.
I'm Dina Johnson. Like I said, I'm with the Early Childhood Training Center in La Vista, which is part of the Nebraska Department of Education. My main role is to assist parents in finding childcare. We have a website called the Child Care Referral Network. And the web address is nechildcarereferral.org. Now this lists all licensed child care providers in the state of Nebraska. And you can search the website in various ways. You can look to see what hours they're open, what ages they have openings for, and if they offer child care subsidy. On the flip side, we also want providers to register, even though their name's on there. If they register, then they can put their information in as to what age groups they have available, when they might have an infant site or an infant placement open, because infants, of course, are very difficult to find spaces for. And then they can put in their own hours and other information, put up their own photo, and make it more friendly for the parents to search for them. So we want both parents and providers to get on this website from the 2 sides. I also have this book that I hand out to anybody who wants it. It's called Learning Begins at Birth, and it talks about learning at birth, what you need to do as a parent, and then goes through the different ages. There's several different resources in the back. The resources are statewide. They're not just in the Omaha area, and my services do include the entire state. So that's kind of why I want to come out here and get this information, because I don't think a lot of people know that this service is available. And when people call me to look for a child care provider, all that's free. I also talk to parents about how to interview child care providers, red flags to look for, questions to ask and things like that. So it's not just getting on the website, it's especially new parents that have never had to put their child in a program before. Some of them are very anxious. And so to be able to spend that time with them on the phone. And when I go to family fairs or job fairs, I attend those as well and talk to parents to get that face-to-face and educate them so they feel more comfortable about making a choice where to put their child.
Veronica with the Safe Center, we help individuals that have experienced any type of violence, so sexual violence, domestic violence, human trafficking, stalking, dating violence. Some of our core services, we provide emergency shelter, counseling, we have support groups. All of our services are free and confidential. Our counselors can see children to adults. We have a young adult prevention resource called Verify. We talk about healthy relationships. We can do community presentations. Verify is geared towards youth and young adults. So we try and stick with that, but we can talk to adults about that as well. We work with UNK and I've done presentations on bystander intervention for sexual assault prevention. We've done some presentations in the schools and would love to do that more with just, again, talking about healthy relationships and red and green flags in relationships, things like that. We have a program we're looking to launch next year. It's called Safe Bars, working with establishments, or alcohol serving establishments, training staff on bystander intervention, so they can prevent sexual violence. So that's something we're working on. Yeah, good.
I'm gonna give my time up to someone else. Emily with Unite Us, we have a electronic care coordination platform. So you can electronically refer your clients to other providers in the community. So we have about 25 organizations on our platform in the Kearney area. But I cover Grand Island, Hastings, North and South of the Panhandle. So if anybody's interested in learning more, let me know.
Oh, we did have one.
Want to share that?
Yeah. So Jennifer shared, she's with the Children's Movement, I believe, right? She said that they have a sharing and caring scholarship membership for families who meet income guidelines, WIC, Head Start, Early Head Start, pre-reduced school lunch programs, SNAP, Medicaid, Medicare, et cetera. This gives families a chance to get a family scholarship, normally $96.30 per year for $12.84 per year. Currently, we only have this from Jennifer. Currently, we only have 90 families utilizing this membership, but we know there is a greater need. And then, yeah, there we go. And then someone had asked for your information, Dina, so we put that in the chat for you. And if anybody else wants anybody's information, just reach out and let us know, or you saw it on the.
And that resource document will live on that 2030 vision drop-down menu on our website. So if there's somebody that you saw here today, you just want that contact information, that is a living document. So at any time you can go in there and click on it and find that. Let's see, I think it's back to Erin and all right.
Yeah. So last time we had, I think, officially decided who our consumer was, that we will engage and support parents, caregivers, educators, and providers with passion for children from prenatal to young adult, with our primary focus on ages where brain development has most potential, birth to 3 and then pre-adolescence, 10 to 12. We do have this working doc about like what we do and how well do we do it. There was a link on the agenda for a list of collaborative partners. And is that what we passed around to, correct? Yeah. So you can access that on your own computer. The how well do we do it? One of the things we talked about, if you're enrolled, if are you enrolled as a provider in the Unitas platform? And I think, are you going to talk more on that or just Yeah, I sure can. So like I said, we have about 25 organizations on the Unite Us platform. Free for most community-based organizations to join. And for context, my background is also in child protective services. Nicole Hirsch and I used to work together. But we kind of came across in our jobs that we couldn't always get people connected to care. We never knew they got to the next provider. So what's appealing about this is that once you as a sending provider send a referral over to another organization, when they open a case with that individual, you get notified back, which is not something historically we've had in the past. We would give people post-it notes with a phone number and pray on it, hope they got there. But we weren't always the favorite individuals in the room, so we didn't often get feedback from parents that they got to housing, a food pantry, wherever it was. So now we don't have to circle back with families or providers to make sure they actually got where they needed to go. You get notified back, you have visibility of anybody else they're working with in the community that's also a partner. 211 is our coordination center in Nebraska. So you can also send referrals directly to them and they'll do the heavy lifting and send everything out for you. And then you still get notifications back about open cases, notes that are put on cases. We can configure organizations together. I think we might try to do that with a group where we'll house an outside user in with another provider to see if we can send internal referrals. So we're open to different ideas on how to serve the community. So if anybody has any questions or again wants to see a demo of the platform, we have a lot of data also to support the work that's happening. So we can see co-occurring needs across the state of Nebraska. We can see what's happening in local communities. We can drill down to populations that are underserved, health equity information. So a lot of that helps with like grant writing, budgeting. If you're requesting additional positions, we can talk foot traffic, how many referrals were sent to receive within your organization, what types of needs were outgoing referrals sent to. So a lot of information, again, free for most organizations to join. And there was a packet included on the agenda for everyone to check out as well.
Matt, do you want to scroll through maybe a little bit of that data and maybe Emily can kind of talk to some of it's our Buffalo County data and the statewide data. There's some pieces that Martha and Emily both brought to us.
Yeah, so when we talked about that health equity information, so this is something where we can look at race, ethnicity, gender, and tell you how they're being served in local communities if partners are using the platform. So the data is only good as the organizations putting data in, so we can pump this information out. We can also do community information, so we know what's happening in local communities where there's providers on the platform and what services they're providing. We know what gaps in services look like across the state. We know what co-occurring needs look like across the state as well. So in Nebraska, if there are two needs for a client or a family, the most utilized need in Nebraska is housing, and combined with housing is actually food insecurity. So we have all of that information as well, so we know what's actually happening out there.
Emily, is this the state one? I think you sent me, right? With all the state?
Yeah, that's the whole state. Yep. So it talks about how many referrals are being done in the state, what population is served, how many referrals have been opened and closed out. So it also shows what the resolution is. So sometimes that's the client self-resolve. So maybe they accessed a food pantry before that provider was able to reach out to them. So it's self-resolved. So we track all of that data too, so we know what's happening. You can also track. Yeah, so you can do it per county, you can do it by organization. There's just tons of information that we can provide about what's actually happening out here.
And this is your Buffalo County data, what currently we've been able to pull out. This is what Martha was able to pull out of the system, what, about 2 weeks ago? So this is how it's currently being used in Buffalo County. Do you have anything else to add there?
I don't think so. No, if you have more like detailed questions or want me to explain these, we can meet one-on-one and I can go through some of this.
You said there are 25 organizations currently using it in this area.
Right.
Do you have an idea of how many organizations could be using it that aren't?
All of them. So anybody can join. There are parameters. surrounding that. It's mostly nonprofits, healthcare providers,
Right.
therapy organizations, CHI, Carney is on. Yeah, food pantries, ministerial associations, churches, YMCA's.
Like you have a
libraries.
list of people you're trying to get on that they could help.
Yeah, it's a lengthy list because I cover like 60 counties in Nebraska. But if there are people on the platform or you want to give me a list of people to reach out to, we can do that, co-host meetings. We have information sessions once or twice a month that we can funnel people into. We can do Zoom stuff. I can be in person at present the collaborative. So similar to this, we do this across the state.
I could speak a little bit to Buffalo County Community Partners and what our plan is and rolling out, and making sure we're getting those connected referrals is through our community response work. So Martha's our bilingual central navigator and Wanda's our lead central navigator. So as they're working through those referrals, which by the time we get the referral, they've already been through all of the resources that are available in the communities. When they're getting to us, it's those very scarce resources or those identified gaps. And so we're using that system from both Martha and Wanda's perspective. When we go to make a referral, we're contacting that group. If they're not on there, we're trying to help them get that connection. So it's a little bit easier for those agencies to make those referrals. So we're going to do it on a one-by-one case and just helping people through that process and to see that benefit instantly of getting the referral process set up there. And I know, Martha, you spent most of your time in that. I don't know if you have anything else you want to share.
Yeah, it's been beneficial because as soon as I send that, it'll ping, it'll notify me if the person has opened it, and it can, on the platform, they can write notes if they're at capacity or the person has already exhausted resources with them, or if they're going to send that referral to someone else if they're not able to meet that need. So it's been very beneficial the times that I've used it, and it's been a quick response because it prompts the other person who receives that referral to contact them directly. And for any consent, you can, you have to have consent of the person to send that referral. You could do it through phone, it gives you the script, or you can send them a text and they click on it and they can approve it through a text. So there's different ways to get that information so that referral can be made.
I mean, the source of my question was, I asked our care management team if they're using it, and they said they're aware of it and they've used it sporadically, but there aren't enough other community agencies on it to make it as fruitful a tool as it could be. So the question is there anything we can do to help other agencies realize that they would benefit from?
So Abby and I have been working pretty closely together to kind of do some outreach, but we needed CHI trained to use the platform to kind of take the next step. If they can't see the value or understand kind of how to use it, it's not helpful to say, come on board, we haven't used this and we don't know the benefits, but come hang out with us. So now that we have Abby's team trained, I think we'll probably move forward and trying to onboard other organizations. But Martha and her group over there are really good about sending me emails if there's a partner that they identify that would be a good fit. They shoot me over an email so I can touch base with that person, like a warm handoff, which works the best. We also have a partner onboarding form that I can email out to people. So if you guys have an idea of an organization that should be on or wants to be on, or you want to be on, you can fill that form out with contact information that I can reach out to organizations. There's just so many in the Kearney area. I mean, there's probably 200 or 300 organizations that I've reached out in the last couple of years. So, but if you have one in particular, I can tell you like what the history was with them, or if they turned it down, or we haven't had any luck interacting. We track all of that stuff, so obviously we track it.
Well, this is one of the tools we've talked about in that results-based accountability model that Erin was walking through, one of those three quadrants. How much are we doing, which is like all of your programs that you're doing, you can count the number of people that you're impacting, how well are we doing it, you're doing great, good client information feeding back to understand how you can improve programs. And then that last piece is anyone better off. We feel like this is probably one of the best tools we have is Unite Us, and have that referral system to really understand how well is a family, are they better off receiving the services that our community is offering. So it's that next step for us that I would say, frankly, we just haven't done a really good job as a community. And so that's the questions we're asking. How can we do this better? And is this the tool that can help us get there?
I really like to throw in my 2 cents is, you know, the data that you can help us with, if we could get all the organizations cooperate, I think would be wonderful. Because it really does point out our gaps. So I think we ought to figure out how we can, either through us or even Give Where You Live, to the Community Foundation, how can we get all of these organizations that are out there helping people to cooperate so that we can find out how well we're doing. I think this is certainly a possibility to help answer some of those data questions.
And I think that's a conversation for all of you. I mean, you're collaborative, you're coming together to impact children and family. So I think just keep thinking about this. We're going to keep putting it in front of you, but as a collaborative, I think at some point you're all going to put some skin in the game, right? Is this the tool you want to use to find out if anyone's better off? I think that's the question we're kind of posing out there each time. We're going to keep bringing Unite Us. We don't know if there's other tools. There probably is other tools, but at this point, Unite Us seems to be like a really nice piece. If we were all using it as a collaborative, that would make sense for the community. And maybe I should just pause there.
I have a question about it.
Yeah.
As far as like healthcare providers, would there be issues with HIPAA?
No, actually, we're HIPAA for we align with them, we align with VOCA and VAWA as well. So you're actually getting consent from the client before you can send a referral. So the only information that we house of theirs is contact information. There's no health information in there. So when you get consent, kind of like Martha talked about, you get consent before you send a referral, you read them the script. We send to 50 different languages at grade reading level. So you can also send it in whatever their language is. You can get consent like in an intake process if you wanted, even though they don't identify an additional need outside the scope of what you do. You can just have printed consents, and then you can upload a consent into the platform. We also have something called a prepare screening tool, which is like a baseline of where they're at. It asks about 30 or 40 questions in all areas of their life: housing, food, education, employment, mental health, domestic violence. Then based on their answers, it will suggest referrals for them based on their needs. You don't have to send 10 referrals just because they have 10 needs, but you can then filter it and decide what their highest need area is. And then that screening tool lives with that person on there, what we call face sheet. So other organizations have access to that screening tool as well, so they can see it. So we have a lot of different prompts in there.
So any organization that signs up for it can fill that out with someone they're working with. Okay.
Yeah, so last time we also talked about Brain Injury Alliance. I guess that was on their steering committee meeting. And they also have a screening tool for traumatic brain injuries. So that's something that I'm working with our leadership team to see if we can add that screening tool, not just to Brain Injury Alliance as a partner, but to other organizations too, if there's a need for them to do a screening while they meet with somebody.
Yeah, the steering committee is, I should do just a little commercial for the steering committee. They're the group that helps try to set your agenda and kind of help you think ahead of where you guys are all headed. And so they're really working on the data piece to be able to bring that back to you for conversations. And a few of the steering committee members are here with you too, and take that back to that leadership. And so one of the things that I think is really interesting, and I'm not going to remember the exact data, but I do believe it was well over 60 or 70% of youth presenting to diversion presented with one or not multiple brain injuries. So it was one of those things that we're thinking of is the relevance of screening for brain injuries and understanding brain injuries, and some of the work that you guys are all talking about, the importance of healthy brains. There's definitely some caveats to that work, and we're seeing a lot of the brain injury screenings are coming up with multiple injuries within the programs. Anywho, what more, maybe I should just ask this question, what more could we bring to you as a team that would help with this conversation? You want us just to keep talking out loud about it and how it might work?
So depending on your organization, if we don't have a similar organization on the platform in Nebraska, we can connect you with an organization in another state that uses the platform to kind of process through what that would look like for your organization. And then I work with the configuration team to kind of figure out how to onboard organizations to meet their workflow the best, which is how we have this kind of idea of maybe housing a user outside of their program, but with another agency that might come on the platform to just make the workflow a little bit easier. So we try to problem solve around whatever the needs are for that provider to make sure that it's going to be healthy for the network. And I didn't talk about this, but we have network standards as well. So we have a team that monitors referral traffic. So a provider has 2 business days to respond to a referral. And if they don't, nobody gets in trouble, but they get contacted by our team just to make sure that they know that there's a referral sitting out there so they don't fall through the cracks. And a lot of the time, the referral has actually been handled, but it is handled because somebody walked into a provider instead of waiting for that provider to contact them. So it's just a matter of going back into the platform and clicking accept for that referral, and then we have the data to support that that person was served. So we have a lot of checks and balances to make sure that we have a healthy network as well.
Okay, we're gonna keep asking questions of all of you. How much are we doing? How well are we doing it? And is anyone better off? So you're gonna just keep hearing those 3 questions over and over again. So I'll just kind of pin it for now, and we will come back and keep asking those questions because these are things we're gonna have to figure out as a collaborative.
One more question.
Yeah.
You just said click it and it shows the patient served and we get that data, but do you then have qualitative data on whether the problem was resolved, or do you just have that higher level?
Yeah, we do. So when I talked about the client could self-resolve, so that looks different than it being resolved by an organization, or if they're not served, we have that information as well. You can also reject referrals. Nobody gets in trouble for that. There's nothing wrong with rejecting referrals. You can actually funnel referral traffic for your organization too. So Martha talked about programs being at capacity. You'll know a program is at capacity before you even have an opportunity to send a referral. You can toggle referrals on and off depending on capacity, funding, whatever that looks like for that program. So you won't be allowed to send a referral to a program that doesn't have capacity or can't meet that need. There is eligibility criteria too that you should read through before you send a referral to make sure it's an appropriate fit. Because organizations do reject referrals. They'll tell you why they're rejecting it though. They'll say we're at capacity, they don't meet eligibility criteria, the program's out of funding. So if one does slip through that they have not toggled referrals off, you'll get a reason to support why it was rejected. And if that organization doesn't reject it, they can forward it on to another organization. So I have 3 transportation organizations in the Panhandle that all work together. So if one can't serve that client, they'll forward it to the other 2 organizations to make sure that somebody can serve that person. So rather than rejecting, they just forward it.
Good question. Checking in on our agenda, we are over our time limit, so I've been processing what we might still be able to accomplish in the next 15 minutes. I don't know that it gives us enough time for what we had scheduled around 1:10 this afternoon with us to revisit our action planning and break out for 15 minutes action plan and then come back with some priorities. So should we table that to the January meeting? Are you guys okay with that? And I think this next conversation actually builds on the conversation we're currently having, which I want to jump to 150 on your agenda, which is a request of a collaborative sponsorship. And so it's kind of that same question I just asked you. Is there a time when this collaborative would endorse work? Because it makes sense for the work that you are doing around the table and you are all coming together to say, we support this, we bless this, we sponsor this. I think that's some work that you guys could do as a collaborative. And so some of the work that Community Partners has been doing along with your steering committee and some of the board committees is we were putting together what we've been showing as a decision-making matrix, which is also in your pocket. And so some of the things that we're looking at to help guide you in making decisions, if you were to endorse a program or endorse a procedure or policy is to start asking some of these questions. And actually, Matt Lohmeyer and I walked through that not too long ago with the violence prevention group, just to kind of see the work that they're doing and how this matrix might align. So the first question you might ask yourself as a collaborative, when someone like Kearney Public Schools is coming to the table, they have an amazing program called the Student Assistance Program. Dan and I have had some conversations about Buffalo County Community Partners endorsing that work and what that might look like. We also had a conversation about what that would look like if the collaborative themselves endorsed the Student Assistance Program. So we're presenting a couple of things. We're presenting the Student Assistance Program as an opportunity to have a conversation about whether this group is ready to start doing some endorsing of work or programs or evidence-based work that you want to make sure that is a part of who you are and what you're doing and what you're wanting to accomplish in the community. So I would just test our decision-making matrix to some degree and begin asking the question. I think you've heard quite a bit about the Student Assistance Program. So I think the first question I would ask, do you feel like the Student Assistance Program that Kearney Public Schools has been presenting is a fit with your shared agenda? And if that's confusing and you're not sure if you can even answer that question, throw that out because we're all in that same state of confusion, or somebody might see it very clearly and feel free to throw out your clear thoughts.
I'll first, as I understand it, it's like a BAP in a corporation. It's not the solution to everything, but it's a good sort of solution to immediate needs and can help connect people to longer term solutions. I think that's desperately needed. And so great investment and we should support it in whatever way we can.
Thank you, Matt. Open further comments.
I guess in the CPS world, uncontrollable use, law enforcement side of things, when we had to go out on call, youth were mainly what we dealt with. We didn't deal with a lot of abuse, neglect situations after hours. It was a lot of mental health calls, uncontrollable kids that there was probably some type of mental health crisis happening when you got to the root of what was occurring for that particular family. So I think the idea of kids are great at noon when they're at school, but at midnight, we don't really know what's happening. I think that's a population that needs served and we need to pay attention to that. We already know that mental health is kind of in crisis with no matter what the age is, but if we can alleviate some of that and intervene earlier, that could be part of the answer. So I think it's a good idea.
And I give second your thoughts. And I think one addition comment that I want to make is I've had, I guess, not first-hand experience with people telling me things like, it's 2 a.m. in the morning, I don't want to wake my parents up and I don't know what to do. And you know, I don't want to call 988 or 911 because I don't think that I'm there yet, or I don't want to the ambulance to come here. And it's just scary, you know, for a teenager to make those phone calls. But I think the system like this would help a lot tremendously, especially during those after hours, midnight crisis moments where maybe they may not be suicidal yet, but they may get to the point if nobody intervenes.
And it could alleviate law enforcement intervention as well. I mean, I know that they have that critical response crisis response team where, at least for adults, we're not arresting the mental health out of somebody, or arresting for behavior, not a mental health issue. So I'm glad that we have like clinicians that can go out with law enforcement and understand the difference about what's happening. But if we have a number that they could call after hours, a student, that is much better than law enforcement intervention, in my opinion. That just opens the door, I guess, for further more. That's not a proactive approach. This seems more proactive than reactive, which is sometimes what law enforcement ends up being. The situation's already happening instead of being proactive with phone number and someone to call.
I think what I hear both of you saying too is in that area of question 3, what is it a clearly documented gap in the community? And I think these are not new things that we've heard in the community, how important those gaps are to be filled. Some of the early work with Healthy Minds that Tana and Dr. Schaefer and a few of you, I'm sorry if I'm not mentioning your names, and Jason, sorry. I know there's several of you that were on Healthy Minds before the pandemic. And that was a clearly documented need that after 6 o'clock or after 5 o'clock, there is not a lot of mental health support services in the community. And a lot of families need those supports throughout the 24 hours. And we don't have a lot of capacity of mental health providers either. So those are a couple of gaps. Helping Minds people, those are a couple of significant gaps. Were there other ones? Do you remember that we talked significantly about over the last few years? Multiple languages. Bilingual therapists.
That's what I got from a high school perspective when we're trying to reach out and get sessions lined up or referrals made for students, other languages that it's hard to find.
We try to keep a pretty good tie on who is bilingual in the community. We have 2 providers. 2 to 3 providers, currently bilingual mental health providers in the community.
Usually
Very
there's a wait
limited.
list.
Yeah, there's a
So if
significant
we
wait
can
list.
have this bridge, that will give them 5 sessions with somebody until we belong in our community. I think that was really beneficial.
Other thoughts?
So, Krista Fritzen, I had talked in the past about the warm line. So I don't know if that's being, if people are getting educated about that, and I don't know anything about it other than it's not necessarily a crisis, but just somebody that they can talk to. So I don't know if that's being educated or the resources for the schools or.
I don't know if the warm line is launched, has it? It's been kind of a concept, am I right? Anybody?
I don't know. Maybe it's.
Okay, well,
I think just in concept form, but I don't know that it's actually been rolled out. Help me, anyone? Help me.
It seemed to me that there was something like in Northeast Nebraska, but I don't know if it was for statewide or I just am throwing that out because, you know, that seemed to be.
There was a model program somewhere that we talked about on Healthy Minds that we could replicate. But I'd have to go back to notes on that.
I don't think it came, I don't think it progressed to where there's any service like that in our region.
I think it was just our big idea.
What's that?
It was our big idea, what we would going
And I think, I think one of the things that should happen, is this should be a community response, not a school response. So our agent may be the school, but it ought to be a community response. Because, we sat around the table and talked about mental health issues. And somehow we have to make this not a Kearney Public School issue, it's a community issue. And it's receiving help 24 hours a day, not going to the emergency room where there are no mental health workers. How do we do this as a community? So I think that's really important. If we endorse this, we need to find the language, maybe Michelle can help us to make sure that this is a community response. And we're co-sponsoring it or collaborating or whatever we want to do. But I think, as I've thought about this, that's a very important thing that we do as a community group. Is have that response.
Is this something that's only available through a school though? Or can it be a community thing?
This program,
Yeah,
I believe it's only in schools at this point in time, but I haven't asked that question, and it's relatively new to schools, quite frankly. This is a new initiative through the original EAP. And I think we will be the first public school in Nebraska. And in fact, I'm pretty darn confident of that, the first public school in Nebraska.
And what I don't want is I don't want the school to be condemned for trying to be proactive and help out kids.
Yeah, and I think what also I'm hearing, if I could paraphrase a little bit, if this group decides to put their endorsement on this, that we're joining Kearney Public Schools and saying this is a community response, that this is a key piece that our community needs, it's filling a gap, that we as a collaborative understand that we all need to coordinate with the schools to ensure that it's successful in serving families. That's kind of what I'm hearing.
Well, there is something said for the community response. I know I've had a positive feedback from parents in the last 15 years when they know we have an interlocal agreement with Kearney Public. I have Infinite Campus on my desktop. I can look at the students' attendance. I don't look at behaviors, and it's just with the kids that we have truancy referrals or diversion referrals. And the parents are like, well, you're gonna take off community service when they bring their grades up? That's a great idea. I mean, they can tell we're coordinating the work with the schools, with the county attorney's office, with other service providers. I've never, in the 20 years I've been there, had a parent say, oh, I'm gonna file a HIPAA report, or I'm gonna do, you shouldn't have that information. I've never had anybody threaten to sue me because I have too much information to help their kid. I guess I'm still waiting for that day when somebody, let them know they can spell my name with a K instead of a C when they work. I'm there to help the child and the parents, not to get anybody in trouble, whether it's HIPAA, HAPA, HOOPA, terminology.
Thank you, Doug.
The other thing that I would just say is, and I think a lot of you might have been on some of those calls back in 2020 when the board first started work prior to the collaborative being created. And we had, we divided up the different areas and invited people like you to come in and share what are some gaps. That's some of these solutions that we're talking about is everything that we heard and everything that we talked about, and how that mental health issue crosses over into all the other areas and the gaps that are there. So I think that it would definitely be a benefit to all those areas that we've.
And I don't know, since we have a board member here from public schools, I mean, I would think that that's what you want to. Community response.
Oh, yeah, I mean, I've said that for a long time, but especially now, I mean, the school is just one little piece of the puzzle, and many of the things that sometimes get turned to the schools to solve, from drug abuse to tobacco to whatever, it's not really a school issue. It's just that the kids that are there and kind of a captive audience, so it's much more a community issue. And I've said for years that your public school system, well, any school system, this is a reflection, not just, it's a reflection of the community and the society in which you live. And so the more partnerships you have between the two, the way better off everybody's gonna be because of that, because nobody does it like themselves. Can't.
Well, a couple of things that I want to get to so we can get you out of here on time. I want to think a little bit about what an approval looks like, if it's a vote, or a consensus, those kinds of things. And the second piece is I want to bring your attention back to the decision-making matrix. I heard fairly strong alignment with the shared agenda for your first question or first factor, fit with the collaborative shared agenda. I'm hearing a very strong alignment there. And number 3, I'm also hearing very strong positive around prioritize gap in the community for number 3, which is needs a clearly documented community gap, which the playbook is referenced there. More to come on that down the road. The piece that I think maybe what we are kind of thinking about and haven't really talked about, but I hear it in the conversations, is number 2. What data will KPS now have that will help inform us on how well the system's working, what's not working, and what do they need from the community to ensure that that last question, is anyone better off because of the program being delivered in our community? So I think that's maybe more the data piece. So what kind of data will come back to the community to help them make informed decisions to ensure that people are better off? That's just my 2 cents of looking through this decision-making matrix. If this was a tool that would be helpful for you in moving forward. Did you hear something different than what I heard? How do you want to make decisions? Voting, motions and voting? Yeah. I'll hand it back to leadership then. You want to ask for a motion?
Motion to approve.
Motion to endorse the student assistance program is meeting a tremendous community gap, and that it needs the support of the community to ensure that our youth and families are better off. Tweak that language a little bit. And that we support that as moving forward. And as organizations, we're coming together to help support this work.
And can we add in there, as part of our support, we just like to report back on the data. We want to know the numbers served. We'd like to know the gaps you encountered. None of those would be HIPAA violations. You're not asking for any diagnosis. I think there's people that called that felt that they were in need. How many? And, you know, were we able to fill those needs by asking what are our gaps?
Sorry, I was going to say, Lacey, I think I saw you unmute. Do you have anything to share? I think we're back to where we were. If you are talking, we aren't hearing anything.
Can you hear me?
Here we go.
Yes.
Okay, so great conversation. I've been trying to find a good time to like give you kind of like a little bit of feedback from the hospital perspective. I know we've talked, maybe all of you, but some of you in different meetings about some of the strategic planning happening here at Richard Young. And so I just kind of wanted to give a quick update on that. We are looking and seriously moving towards an urgent care model here. We have hired a nurse practitioner that's going to be starting in February with us. Primary goal and use for her is going to be that. So just keeping that in the background and in everybody's mind that we are going to have an urgent care for mental health. I don't have a timeline yet, but obviously this group I will keep well informed as we move into, we've made obviously goals and strides towards it with having someone hired. So really excited to offer that to this community for folks to come in and not be able to see a provider right away versus being, sent home with an action plan or a safety plan or having to wait a couple of days to see a provider. So we're really excited about that. And I know this group, when I met with you almost 2 years ago, some of you, there was a lot of support towards it, and I know that it's still a gap, and we are looking and pulling numbers currently just to kind of have some data to share with you on how many folks, especially adolescents, seek this care. This urgent care model is going to be for all ages, but a lot of centered around the adolescents. We do have an adolescent psychiatrist in Omaha that's going to help build this program and really be our backup. So looking to get a lot of insight from him on how things are working in some of their urgent care models that they have already in Omaha. So I just wanted to give you guys an update. It has not fallen off the map. There's definitely movement with it. We have some strategic things that we want to do with our environment here, which are costly, and we've tried securing some funds with those things, entered a lot of different grants that we're hoping that we get some monies there. That being said, we do have a plan to roll out this model before the construction stuff would all be completed, just because we know that the need is here and now, not, 5 years from now or whatever. So I just wanted to give you guys that update. I didn't know the perfect time to do that, but just so that everybody knows that we are still strongly moving towards having that here. It's going to happen. It's not an if, it's just a when. And we do have a nurse practitioner hired for that program.
That is very, very exciting news, Lacey. Thank you for your hard work and your whole team and the community that's been wrapped around you in this work. It's not easy work, it takes time, so thank you for sharing. I'm gonna say we have a motion on the floor. You want me?
She approved.
I approved. We got a second? Okay, any other discussion? Anyone have concerns? This would be a good time to share those. All right.
I'll just throw out that, I know there's a pretty big financial investment in this program. And if we really want it to be a community program, there probably needs to be skin in the game on that as well. So that it's not just the school. Children that. So, for that, don't know what that means, except that some of the resources need to be unfolded to help offset that cost.
Any donation for that?
Directly to Kathy's son, huh?
I agree with Matt. I would be in favor of an endorsement. I know this is our first one, it's difficult, but I would love to see this fleshed out a little more before we do this anymore to know what an endorsement really means. Because I agree, you know, with Dr. Schaefer, like it'd be great to see the data. But then as he was saying that, I was like, oh my gosh, there's more work for you guys to do. Like, I just want to make sure that we're balancing what that looks like for that organization and that we're clear about what that endorsement means so that it actually means something.
Can I also add that I keep going back to who our customer is? Right, I think we established that it's the parents of prenatal 0 to 3 preteens. So if we're endorsing programs and services, are we adding an element of how are you communicating this program for kids to our customer, which is parents, right? So I just want to make sure we're not forgetting, yes, great program, I love it, we support it. but also, are we remembering who we're advocating or serving? And how that
Any other comments before I ask for this? All right, all those in favor? Say aye. Anyone opposed, same sign. I documented those conversations. Maybe could I just ask if anybody's interested in fleshing this out more and would like to have more conversations, maybe to let Dan or I know? Because it may take a couple more small conversations to flesh out some, flesh out.
I think
some of the
eventually
issues.
this has to go to the board. This has to go to the board.
Which board?
Buffalo County Community
Oh, okay. Okay, yep, we
I think
can,
if we're gonna endorse it as an organization, it's okay for the collaborative.
Yep.
Make that recommendation, but I think this has to be a board decision.
not meaning that the board would supersede what this decision was, because this decision stands, because it's the collaborative, but the board also needs to be a part of this conversation, right?
Correct, and I think if we're gonna approve something for the organization, the board has to approve it.
You'd want co-sponsorship of whatever the collaborative is doing.
I think
Possibly.
we're the organization that controls them. So I really do think this is a board decision. Collaborative makes the recommendation. And I couldn't see why the board wouldn't surprise it, but that's the place where if there's other questions.
Yeah, you guys are tiptoeing in that space that we've been saying all along, we need to figure out. Right, Nadia?
Yeah, I'm writing down org chart right now.
Yeah, and Kathy's inherited it from Nadia and I, so we've been. Yeah, it's, thank you. Everybody gets that, right? It's, the backbone is Buffalo County Community Partners. You're the collaborative. You have those decision making, but also what's the board's stake in this piece too? Buffalo County Community Partners board.
I wouldn't mind having like another additional conversation just to, you know, get more details about how this is all gonna work and what it looks like and goals and outcomes and making sure that we're collecting if we need to based on like the big picture.
And I appreciate, you know, your comments about the data and stuff, but obviously with the investment that we're making in it, we're wanting a lot of data. We want to make sure it's making a difference, otherwise it's not worth the investment. So that's one of the things that the school board, when they brought it to us, we said the very same thing, so. Yeah, it'll be a big part of it.
And we signed a 1-year contract. For multiple reasons. One, again, we're tiptoeing into this as many other districts have not. But also number two, if there were to become a program equal to this that was local, boy, that would supersede this in most of our eyes, I would think, depending upon, again, a number of variables. But if that were to be created, that would really be the creme de la creme.
To have that local face-to-face contact versus virtual would be beautiful. Okay, what I'm hearing is you voted to endorse. I'm not going to try to repeat it because I know I won't unless Martha's able to repeat it for the minutes. Motion.
I had put motion to endorse the student assistance program in meeting community gap and support for friends, families was approved. And seconded.
More conversations needed. Let's keep fleshing out our matrix that we have out in front of us. I think it could be also a tool for the Unite Us conversation, right? what are we asking Unite Us to support for the collaborative, and how do we endorse that as a group? So I think there's other pieces like that that you could also kind of run through that decision making. The board members who are present, we'll take that offline and have a conversation about the board side of this. And Dan and I will talk some more as well, and hopefully at least a handful of you will let Dan and I know that you'd like to have continued conversations outside of this table with us to make sure that we're taking right steps as a community to be successful. Right, I think we did not post a December meeting because I think we land right the week of Christmas. So your next meeting would be the end of January, and we can go ahead and get that on your calendars. So leadership, anything else you want to share or next steps? All of you stay healthy for the next meeting. All right, everybody have a great holiday. Merry Christmas. And happy Thanksgiving if you're still celebrating.